Welcome to the DSO Hygienist Podcast, where we deep dive into the world of DSO hygiene. I'm your host, Christine Deal. I'm a practicing clinical hygienist with over 30 years of experience. 7 years ago, my private practice was bought by a DSO. I am an advocate for hygienists working in the DSO space. Your journey to happiness and success begins here. Amanda Hill, BSDH, RDH, CDIPC, is an enthusiastic speaker, innovative consultant, and award-winning author. A sought-after thought leader, contributing valuable and inspiring insights into the current trends in dentistry. Affectionately known as the Waterline Warrior, she brings over 25 years of clinical dental hygiene experience and education to dentistry. She is the recipient of ADS's Emerging Infection Control Leader Award. She is also an active participant in the advisory boards of RDH Magazine, Dentistry IQ, and ADS's Infection Control and Practice Editorial Review Board. Amanda strives to make topics in dentistry accurate, accessible, and fun. She can be reached at amandahillrdh@gmail.com. I want to welcome Amanda. It is such an honor for you to be on my show, so thank you so much for coming on today.
Thank you for having me. I'm honored that you asked me to be a guest.
Well, you're coming off the amazing mega session you did at RDH, brought the house down.
Oh my gosh, I think I'm still, it's been a few weeks. I'm still kind of tingly about it. I'm just so excited that it went in my head. You have expectations in your head and you don't always deliver on what you think in your head. And man, I felt like I killed it. Like it was exactly
you nailed
what I wanted.
it. Yeah, so for those of you who didn't get to see this in person, we're going to talk a little bit about what you did talk about. So we're going to talk about curiosity today, which I'm very excited about because I think we all need to be more curious. So let's talk about curiosity. What sparked your initial curiosity in pursuing a career as a dental hygienist?
So it's actually a pretty funny story. So I was 15 years old, and I decided that I wanted a job answering phones. I had a job answering phones at Domino's Pizza, and then I worked at a shoe store. But I thought an office, just sitting answering phones, would be like the coolest because back in the day, that's when we used to just talk on the phone all the time. This is pre-cell phone, pre all those things. And so I called my pediatric dentist and I said, "Hey, are you hiring?" And they said yes, and they had me come in for an interview. And so I interviewed with Dr. Kramer, and he hired me. And so I show up the next week for my first day of work, come after school on a Wednesday after school, and they hand me an apron. And all of a sudden, I'm a dental assistant. I thought I was going to be the girl at the front desk, but no. I'm a dental assistant. So in the state of Virginia, you don't have to have any training to be a dental assistant. And so here I was, all of a sudden, this dental assistant. And so I quickly learned, how to pass instruments and how to turn a room over. Back in the day, that's when we were still just turning a room over with alcohol 2x2s. You're just wiping things down with alcohol 2x2s. We didn't wear masks because pediatric dentistry, that's scary. And, barehanded into cold sterile. I'm surprised I don't have tumors on my hand. Anyway, but I really enjoyed it. I really felt purposeful. And where my other friends, had jobs at Domino's Pizza and things like that, I really felt like I was kind of embarking on something that was real. And I watched the dental hygienists in that practice. And there was two of them, and they both worked part-time, and they both had families. And I really liked their kind of work-life balance that they had. And I knew that eventually I wanted to have a family. That was a goal of mine. And so I thought, man, that dental hygiene thing looks really fun. And so I applied to a couple of colleges, and one of them being Oldham University, who has a dental hygiene program, and decided that, right out of high school, I was going to go straight to college and become a dental hygienist. And so that's what I did. So it wasn't like a lifelong dream, but darn it all, it definitely was right around the age of 15.
Wow. How do you stay curious and engaged in the latest developments and advancements in dental hygiene?
Oh gosh, there's a million ways. Frankly, my family actually had to put me on a little plan during COVID to on a webinar, like Webinars Anonymous, because I was taking a few too many webinars, and they're like, you're never at dinner. Like, I'm like, okay. So like, sometimes I actually have to limit my curiosity, because I can like, just dive into learning and never actually doing. But I mean, I take webinars, I go to conferences, I read magazines, I listen to podcasts, I network with friends and just have really fun, geeky conversations. And then also I say yes to opportunities to do things that maybe are a stretch for me. I was just telling you the story before we started, Christine, that recently I just said yes to being a co-author in an article that will be in JADA, the Journal of the American Dental Association, on antibiotic stewardship and infection prevention. And they assigned me 2 sections to write. And this is, I got to tell you, Christine, this is a stretch for me. Like, I'm like kind of I don't know. I mean, I write a lot, but I write more just in my own voice. And this is like, official. But doing that and being curious and being brave, with curiosity comes a lot of, you got to be brave. And so just saying yes to things, and you continue to learn, and curiosity keeps you excited. Curiosity just, I don't know, it burns in my belly and my heart, and just keeps me constantly wanting more. So the more I read, the more I want to know more. Right?
Right. Congratulations. That is really amazing. Good for you.
Thanks.
Can you share some of how curiosity led you to discover something new and improved for the practice?
Oh, golly. I mean, gosh, we could talk all day about curiosity and new and improved things. And man, is it changing. Oh my gosh, this is a good one. I just posted about this on social media. So in January, I went in for my hygiene visit, like we all should do, my hygienist friends. Have you had a hygiene visit?
Right.
Like, not just to jump in the chair, polish my teeth, or get the calc between 24 and 25 hygiene visit. I mean a full-fledged hygiene visit with an oral cancer screening and a periodontal probing. Okay? I want you to have it all. Anyway, sorry, I digress. So I went in for my hygiene visit, and, we took our bite wings, and I had some demineralization happening between 4 and 5. And like you see it pop up right away, and you're like, oh, no. No, I'm not having that. And thankfully, because I am curious and because I do work really hard to try to stay up on top of new products and techniques and procedures and things like that, I was like, all right, we are going to take care of that right away. As opposed to, what would we normally do, Christine, when we just saw just a little demon?
Watch.
Let's just watch it. Let's watch it do what? Like,
right.
So I said, no, I want to use, am I allowed to talk products on this podcast?
Oh, for sure.
Great. So I was like, okay, we're putting some Curodont on there. Curodont is a guided enamel regeneration peptide, actually. And so anyway, I literally, the next month at Chicago Midwinter, I had Crystal Spring apply Curodont at the booth at Midwinter. Like, I brought my cordless polisher. I brought some acid etch. Like, we did it. Literally, I brought the Hoopla, which is like kind of like an Optergate, Anyway, The video is hilarious. So I had her place Curodont between 4 and 5, and then you don't know right away if it's going to work. So Tuesday, just this past Tuesday, I had my hygiene visit, and so of course I was like, okay, take a bite wing, and darn it all, if that demineralization isn't gone, like the tooth looks solid again, and it was funny because I went in. There's a new dentist in my practice. So my dentist is retiring and a new dentist is buying the practice. And so I was talking to her about Curodont and other SDF and other minimally invasive. So I was talking to her about it, and she was like, "Oh no, I don't really think that's good." And this was a week prior because I was in with my daughter, and she's like, "I'm not sure about that." Anyway, she had lots of questions. She wasn't sure, and I was like, "Well, let's see on Tuesday." And on Tuesday, she looked at that X-ray and she was like, okay, we're going to start that in the practice. And so by, I had heard about it, but I hadn't tried it. And so then I was like, well, let's try it in my mouth, because I love trying things in my own mouth or my family's mouths, because, you can read all of the research studies that you want to read. But I got to tell you, Christine, research confuses me. And I think sometimes research tricks us or how we skew it. I'm not saying research isn't good. Research is very important, but sometimes it can skew us. And so really being able to take a product and play with it and being curious enough to be like, you know what? I wonder if this is going to work. Let's try it on a couple of patients and let's see how it works. And then let's see, let's see if this is something we want to adopt. And I've kind of done that continually throughout my career, doing things like incorporating subgingival air polishing. When I showed up at my practice now, they had the subgingival, they had the EMS machine, and no one was using it. And I'm like, why not? And they're like, we don't like it. And I was like, well, I'll use it. And I got curious, and I watched some YouTube videos, and I figured it out, and I started using it on patients, and patients loved it. And now everyone uses it at the practice. And so it's really, I think part of curiosity is not thinking that you need to know it all, but having the desire to learn.
Yeah, the desire to learn. That is awesome.
Yeah. So I think sometimes we get stuck in that perfectionist mindset where like, I can't try something till I know everything. No, you can try things. You know what you're doing.
Yeah. How important do you think curiosity is in maintaining enthusiasm at work?
That's it. It's actually the secret sauce to enthusiasm at work. In fact, I just recently read on Facebook, some new hygienist was like, all right, I hate this career because it's the same thing. It's Groundhog Day, patient after patient after patient. And you know what? It can be. It can be if that's what you want it to be. If you are a chat and polish hygienist and, you're just doing the thing and you're getting them in and out the door, yeah, it would be really boring. If you are able to take every single patient and look at them individually and kind of almost like you're a detective and you're like, okay, I'm going to be curious here and I'm going to figure out what's happening in your mouth and how we can help you be healthier. That's the thing. That is the secret sauce. Like that is the juice that keeps you up, gets you up every morning and gets you into that office and gets you excited and keeps you engaged. And your patients, I got to tell you, your patients love it. My patients are like, okay, Amanda, what are we going to learn today? They love learning with me.
I love that. I love learning. How do you encourage curiosity and continuous learning among your colleagues?
Well, I'd like to think that just by posting things like, hey guys, look at my x-rays, this is absolutely amazing. I got to tell you the amount of people that have reached out to me asking me about Curodont, or certainly through speaking and writing. And my goal with speaking and writing, and I truly feel like my purpose in life, like what I'm trying really hard to do is to take all the things that we have to know in dentistry, right? There's a lot. It changes all the time. There's studies. There's all kinds of things coming out. And my goal for the boots on the ground clinicians is to take it all, smush it, learn it, and then try to give it in a way that is just accurate, accessible, and fun at the same time. And really helping people understand kind of the new stuff, but not having to sit there and read 45 research papers because that's a lot.
Yeah, and we all appreciate that. Bite-sized chunks.
Exactly.
I think everyone's attention span is like that of an ant.
Right? Exactly.
Can you describe a situation where curiosity helped you solve a challenging problem?
I mean, I think there have been times in my life where I have felt, much like that research article I told you about, over my head, right? And I want to tell you that no matter how experienced you get, and no matter how much you do, and no matter how many accolades you have, and no matter how long your CV is, that imposter voice continues to stay in your brain. And so by learning how to have that by learning how to control your thoughts and the things that you let your brain say to you, really will help you get past some of those obstacles that you have in your life. So, for instance, I mentioned that research paper. I'm also in the middle of conducting a research project on chairside waterline tests because, I love waterlines. I think we're going to talk about that in a minute. But so I'm doing this research project, right? And I'm doing it with some really smart, like researchy scientists. And I don't consider myself super researchy. And the amount of self-talk that I have to do to myself to say, no, you belong here. No, you have a place here, Amanda. No, you bring a special piece of, clinical knowledge, which they don't have because it's research. And so, but I have to stay in that curious mindset with myself. Or else I'd be like, no, I guys, I can't do it. I'm afraid. And so sometimes it's just really how you talk to yourself.
Yeah. I had someone give me some really good advice one time when I was getting ready to speak, and I was really nervous and wasn't sure if the topic was going to, transcend. And she said to me, someone out there needs to hear this. Right. So don't worry about all the people that don't. Worry about the person who does.
Absolutely.
And I'll tell you, I repeat that to myself every single time before I do something, because it's so true. Someone needs to hear it.
It's so true. And, you read those comments after you speak, and, there's always one or two that are just not kind. And I've had to work really hard to just say, that's okay. The 98% said it was great. And those two just, I don't know.
Yeah, don't focus on that.
But it's hard not to, right?
Yeah.
Again, that's how we get back to mind work. You really got to work on that.
So I do love your water testing posts. So let's talk about those. Okay. What are the best practices for maintaining operatory water lines to ensure patient safety?
So the first and most important thing to water lines is you have to test your water. And that's kind of my goal with those waterline test posts that I do, is to let people know, you don't know the quality of the water unless you test it. Water that is totally failing will smell and taste just fine. And so it's really important to establish a testing frequency. Ideally, you should do that monthly until you pass for 2 consecutive months, and then move to quarterly testing. So that's really the best way to kind of establish that testing frequency. Now, along with that testing frequency, you need to have a system of shocking and treating your lines. And so what treating your lines, what shocking is using a high-level disinfectant to kind of blast the biofilm out of your lines. Because think about your dental unit water lines. It's that teeny tiny tubing, and it gets stagnant, and biofilm forms in there, just like biofilm forms in our patients' pockets, right? And so it'll get stagnant, and so you need to have some kind of high-level antimicrobial that you push through. Our office, we shock quarterly. Quarterly seems to be a good system for us in our office. Then you need to have a system of treating, and that's using a lower-level antimicrobial every single day in your water bottle. And I like to say the reason you want to do both is, so shocking is like a periodontal maintenance visit. So it's like you're in my chair, Christine, and I'm doing subgingival air polishing. I'm using my power scaler. I am getting you as clean, as biofilm free as I can, right? But I would never say to you, Christine, I am so good at what I do. You don't have to do anything for 3 months. You don't have to brush. You don't have to floss. You don't have to wear your periprotect trays. You don't have to do anything. I got this. No, we still have you do home care. So treatment is home care. So some kind of tablet, some kind of straw, some kind of liquid, whatever product you choose, but read the instructions, please. And that kind of helps keep that biofilm at bay until you shock again.
Yeah. So what are the potential risks associated with poorly maintained lines?
It's some scary stuff, friends. So there have been 4 cases in the U.S. that we know of, and I can tell you, actually, I know of more that didn't hit the news cycle because they settle quickly, where children have been harmed by contaminated dental unit water lines. And when I say harmed, I mean lost permanent teeth, facially disfigured, lost hearing, not just harmed, I got a boo-boo, take some pink antibiotics, no big deal. I mean serious bad stuff, right? In other countries, we've had 2 deaths, one in Switzerland and one in Italy from contaminated water. And we know there's been some in Argentina, some infections in Argentina as well. Not only can this affect our patients with this contaminated water, but we now know post-COVID, when COVID, we got really scared of aerosols, right? Uh-huh. They were going to take us down. So some great studies have come out. And in fact, it's great because this one study has been repeated now 3 times with the same results. We know that about 78% of the aerosols that we produce in our operatory, they captured them, and they come directly from our procedural water, meaning the water that you spray out of your air water syringe, the water that comes out of your power scaler, that's what we're aerosolizing. And what they found in these studies is that between 0 and 0.5% is coming from saliva. We are not aerosolizing saliva, my friends. We are aerosolizing our procedural water. And so I want you to think about, as a clinician, what are you breathing? Because we're at a high risk for Legionella antibodies. There's a great study about that. And so this is your health too. It isn't just your patient's health. This is about you. What are you breathing all day long? What are those aerosols? Are they safe? If you have a great Waterline protocol, they're totally safe, no problem. If you don't, I'm a little worried about what you're breathing.
Yeah, that's really scary.
Yeah.
Very, very scary. Well, Amanda, I want to thank you for coming on the show today. This was such valuable information. I can't wait for our listeners to hear. If anyone wants to get a hold of you, how do they do that?
Oh, gosh, it's easy. AmandaHillRDH@gmail.com, or you can find me on all of the socials at AmandaHillRDH. So LinkedIn, Instagram, Facebook, all that stuff. I always love to chat. I love to be curious with other professionals, and that's how we learn and that's how we grow.
Yeah. Thank you again, Amanda. This has been so great.
Absolutely. Thank you for having me.
I'd like to thank our sponsor, Twice as Nice Uniforms. Dressing for success, infection control, and comfort is crucial for the DSO team. Not only do they need to look great and feel great, but they need to be dressed for safety. Your patients will notice when your team is dressed appropriately, and your staff will perform better. Who better to help your team with these decisions than Twice as Nice Uniforms? Owned by a seasoned dental hygienist, branding expert, fit specialist, and fashion model, Twice as Nice Uniforms are designed to follow infection control and OSHA regulations, alleviate the thermostat wars in your office with temperature-regulating technology, and provide long-lasting, professional-looking scrubs, lab coats, and accessories. Custom uniform programs will take the burden of painstaking ordering, exchanges, and returns off your shoulders. It's proudly made in the USA. And Twice as Nice is giving our listeners a discount code TDH2024 to take advantage of this special offer. Thank you for listening to the DSO Hygienist Podcast. Please follow or subscribe to be alerted of new episodes.